trying to get pregnant. You tracked your cycles, did everything right, and now you're in the 2-week wait. You go to the bathroom, wipe, and there is blood on the paper. What is it? Implantation bleeding or your period? Let's dive in to find out. Hi, I'm Ina, a naturopathic doctor focused on fertility and a proud mama of 4 after 30, here to help you support your body and get pregnant naturally. So what's the difference between implantation bleeding and your period? Once you ovulate, the egg then gets caught up in the fallopian tube, where it is supposed to meet the sperm. Once the egg is fertilized, it will travel down the fallopian tube, which will take about 5 days, at which point it will enter your uterus. There, it will start the process of implantation. This process happens in 2 steps. Number 1 is adhesion, where the fertilized egg actually attaches to the lining of the uterus. That takes about 48 hours. The next 7 days is called the invasive phase. This is where the egg actually burrows into the uterus and connects its blood supply with your blood supply. Implantation bleeding can happen at any point between those 6 to 10 days. It's important to note that only 1/3 of women ever experience implantation bleeding. So now let's discuss the main differences between implantation bleeding and your period. For one, the color. The color of an implantation bleed would be light pink to brown. It will never be bright red. Number 2, the timing. Because the fertilized egg needs about 5 days to travel down your fallopian tube before it enters the uterus and has the chance to implant, any implantation bleeding can be expected anywhere from day 6 to day 10 post-ovulation. Number 3, consistency. Implantation bleeding is thin and it almost smudges. It is not going to be a thick flow. Number 4, clots. There should be no clots in implantation bleeding. If you're seeing clots, that's probably your period. Number 5, cramping. You should experience no to very light cramping with implantation bleeding. Some people say it feels more like pins or needles or a slight tingling sensation. If your cramping is severe or if you notice that it gets worse over time, that's probably your period. Number 6, duration. You're looking of 1 to a maximum of 2 days of spotting. Any longer and you're thinking period. Number 7, the amount. We're talking slight, spotting, streaking type of discharge. We're not talking full-on bleeding. Hopefully that helped you understand the difference between implantation spotting and full-on period bleeding. However, if you experience any of the following symptoms, this may be a sign of something called an ectopic pregnancy. That is a pregnancy that is unfortunately non-viable because it is located outside of the uterus and it is a medical emergency. So, if you notice any fever, cramping that is getting worse, pain, especially on one side, in your abdomen, your pelvis, or even at the tip of your shoulder, heavy and prolonged bleeding, blood clots that are accompanying this situation, and rectal pressure, you should seek help. If you found this video helpful, remember, fertility is not guesswork. It's biology and you can work with your body. Subscribe so you can follow for more fertility clarity.